Does the minister think patients should have to start paying for care?
No, no, no. OHIP cards are used in the province of Ontario to fund publicly funded healthcare systems. That will continue under our watch. What I referenced yesterday was innovation. We should not be afraid of innovation.
What does innovation mean in the context of this discussion about privatization?
Well, innovation to me is why we have asked for the Ontario health teams to be brought up. We now have over 90% of the population in Ontario with an Ontario health team. That means they coordinate their care.
Now, what the Ontario Medical Association has suggested is that the government build publicly funded but privately run surgical clinics in order to ease the surgical backlog. We asked the minister if she's eyeing a more publicly paid but privately delivered health service like that.
It would be funded by your OHIP card.
But it could be delivered more privately, the more private delivery, right?
You mean like dentists? Like physiotherapists?
Minister, we're asking you. This is not your healthcare system. This is
Ontario's healthcare system. This is Ontario's healthcare system, and we have a publicly funded Ontario healthcare system that will continue in the province of Ontario.
But even the suggestion of more privatization has the opposition up in arms. In fact, the NDP is going so far as to suggest that the health crisis may have been orchestrated with more privatization as the end goal.
They created the crisis by zero base budget increase to our hospital for 5 years in a row, below inflation increase the rest of the time. Now we are in a crisis, and their solutions will be privatizations, will be to make sure that rich entrepreneur builds those new community-based surgical suite.
This whole discussion comes in the context of the government looking for new ways to deal with the nursing shortages, which have led to emergency departments across the province closing for hours or even days at a time. It's a situation the head of the Ontario Nurses Association tells me is still dire.
There are schedules put out with thousands of hours not filled and empty shifts, and the day has not even started.
For City News, I'm Richard Southern.
This is City News Everywhere.